Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get you to the $2 million mark and beyond. So I'm going to go over a few days here. I have a few of these saved up, and I'm going to mostly cover my most valuable patients and some of my least valuable patients. I don't want to go through everything today, but I'm going to share a few things that are working for me. The first thing is I went and visited. There's a new convenient MD around here. I don't know if you have them where you're at, but a convenient MD is basically like an urgent care. And I'm trying to either have them come directly from the urgent care to my urgent care, to my office. And it was interesting. I went and visited them during the lunch hour, and I met Allie, and she was one of the nurse practitioners, and she said, "Yeah, by the way, I do go to your website, and I do actually schedule patients that I see here to come and see you." So I just kind of reinforced that I wanted to see them, that we'd be happy to see them. Our office is literally 2 minutes away, and so it would be a great fit. And I said, we have time for same-day appointments for patients that have urgent care issues. So I think that is going to be a good referral source, them coming right over, because the quicker they can come in. And then I also said, hey, by the way, I'm interested in doing a little workshop for you to go over how to do some toenail procedures, how look at some different X-ray things that I'm seeing in the office. I didn't want to per se, throw them under the bus, but I wanted to help them to get better and to learn more, to more appropriately treat things. And I did also reinforce, we have a couple of doctors that like to do ankle fractures, and I just said, hey, by the way, you can send everything our way. We'll take care of it. So I think that's going to be a big win. I'm going to do a follow-up letter to her, and then even just a follow-up contact to set up this little workshop. Okay, so this is a recording. I'm going to go over some of the MVP patients from a Friday. Okay, so once again, a reminder, Friday in the morning is my routine care, and so I have a nail tech that helps me. So I'm going to talk more about the afternoon. Actually, there was one patient that was a self-pay nail care, but she also had a fracture of the second toe. So we got an x-ray, we got that fracture code, and we got a surgical shoe in the office visit. So that is going to be an MVP patient. She's a 68-year-old female. And so why MVP? Mostly because using the fracture code. And then I'm going to see her back at the next routine care because I think it's going to heal and just fine. I've been using some more prefabs. So for the longest time, I never used any prefabs. I was talking to one of my buddies, and he would say, Don, you really should try to use some prefabs, especially if they're already going to some of the other locations. So I tend to find a lot of my patients, they'll go to like the shoe store that I'm sending them to. Well, there's a couple of them around here I like, which like PR Running and Sneakerama, and they have these prefabs, and they're $40-$50. They're not really that good. I think the one I have better. I have one of these Northwest brand, and it's a dress set or a prefab. And what I like about it is, first, they can't buy it online, so you can only get it through a doctor's office. Second, it has the carbon fiber shell without the heel post, so it's a good device. It's not as good as one with a custom, because the custom has the heel post, but it's something I think is good if they need something. So this is something that I've been doing more of. For the longest time, I was only saying, hey, I only wanted the custom, but a lot of them didn't want the custom, or they weren't ready to get the custom. And so what I do now is I do the prefab, and then if they do want the custom, there's a technique called the rollover technique. And this is something, once again, I learned from Alex Hermosi. And what it is you take the price that they paid for the prefab, and you can credit it to the custom one. So you can say, hey, I know you spent this $60 with me. I really think it's going to be better for you to have a custom device, and I'm going to credit the $60 that you just spent towards that. And you can do that with anything. If they buy it somewhere else, you can even give them a little credit. I know you spent this money already, but I really think you need a custom. I'm going to credit that. Or if they go and get a good feet insert, you can say, hey, I can't give you the whole $1,200 you spend for the good feet, but I can give you, let's say, $60 or whatever you want to do to discount it, to make it a little bit more, make you kind of the nice person. Okay. And then there was a couple of shockwaves. There was one, I'm not going to go through all of them, but peroneal tendon number 3 out of 3. There was a Achilles number 3 out of 6, and this also had a nail sample. So he got my fungal kit and things like that. And I guess my last one for the day was a what was it here? There was a patient that had 4 Swifts, and she really didn't get. They look a lot better. And then I did Cantharidin on her. The reason I'm talking about this is because she was an MVP, because I did the 4 Swifts, And I usually do like a 3-month follow-up, and they're not totally gone. I think they're going to go away. And I'd like to know what other people do. Do you just add like another Swift? I tended to switch to cantharidin because I think that's all she needs. But that is what I did with that patient. Okay. So now we're going to go kind of backwards. That was a Friday. Now we're going to go to a Thursday. So this was a Thursday, and this day I met with Banzai. So Banzai is this new company that basically what they do is they mine your medical record for all the patients that haven't followed up. Basically, we have Clara, which it's called Banzai Health if you want to look it up. We have Clara that kind of calls patients if they cancel or if they miss and they didn't reschedule. So that they do that for the first couple of reach outs. This one starts at about day 7, and it follows up with them, and it does it automatically through your EMR. They kind of pull reports, and the first go around, like anything, is a learning process. So they picked a couple of the diagnoses they thought were interesting to us, and I told them some of them really weren't that interesting to us. It was like calluses and nails, and I'm not too interested in having them come back. I wanted to set up a system to reach out to Shockwave patients and orthotic patients and things like that. But it was the first meeting. It was good, and I think we have to basically narrow down the filters. But this is really, I think, going to almost replace what a staff member could do. I remember, I think I've told this before, but at a recent AAPPM meeting, they talked about this. You like run reports on certain diagnoses, and you recall patients manually. Like this is automated. It is. I think it's going to be great. It's like money in the bank for an office, and for less than the price of an assistant. So I think it'll really pay for itself real quick. So I'll tell you as we continue to do that. Okay, so for this Thursday, one of the MVPs was a 78-year-old female that had ankle arthritis, and I dispensed her AFO, and then she wanted something for her skin, so she got a Marigel Blue. One of my least valuable patients was a fracture follow-up, and all I did was get an x-ray because, once again, because of the global, you can only get the x-ray. So what I'm starting to do with these fracture follow-ups, if they're simple, I'm going to put them in these little 10-minute slots. And in my EMR, I have like 20-minute slots, like 3 per hour, and then a couple of 10-minute slots. And these 10 minutes are just for quick things, maybe that aren't, they don't need as much time. And I'm struggling a little bit with how my EMR is set up. Like the staff sometimes might put something already, like in a slot like that, in the 20-minute slot, which kind of clogs my schedule. But I think like setting apart these 10-minute slots for simpler things that you kind of have to see back, but they're not going to produce as much revenue, so you can use those 10-minute slots. Okay, now some of the other MVP patients, there was, I'm going to go through the Shockwave, which are my biggest things here. A patient number 3 out of 6 for Achilles tendonitis, number 5 out of 6 for plantar fasciitis. There was another patient that had number 3 out of 6 for I can't read my handwriting. Oh, it was Severs. So this is for Severs for this one. Posterior tibial tendon, number 4 out of 6 with orthotic dispensing. And those were kind of the most valuable patients kind of the day. I want to share, there was a patient that came in also with a wound, and I don't see a lot of wounds, but this wound I kind of debrided, things like that, and I just threw on Shockwave. Not that I was going to get paid for it, but I did bill for it. So if I get paid, it's going to be gravy. But I do think that the Shockwave can really help with healing these ulcers. I learned this at this recent Shockwave conference. I did do an earlier podcast talking about kind of the takeaways from these Shockwaves. So if you do Shockwave, I really think it's important to go to some of these conferences. I think it can really help you. Helped me. I don't know if it'll help you, but it's helped me to learn more. Okay, so that was the Thursday. Now we're going to go to a Wednesday. So I have a couple of smiley faces and I have a couple of sad faces. So one of the sad faces is I set apart. I'm trying to do more office procedures in the office versus going to the OR. So this was a soft tissue mass removal I was going to do, and it was going to take 40 minutes, and they didn't show up. So I think if I am going to do more of these office procedures, I really need to make sure they're going to show up. So I had 2 of them for the day, and so it just kind of left me hanging. There was another patient, though, that we did a arthroplasty, so I did that in the office for the patient. And the other day was on a Wednesday. We also did a Thursday. We also did an amputation in the office. So these kind of smaller procedures, I'm starting to do them, giving myself more slot. It'll just save me going to the hospital. Okay. Another thing I learned, and this is really after the Shockwave conference, and I want to kind of be embarrassed as I admit this. I was talking to one of my friends, Matt, there, and he said, "Yeah, Don, I always look at my schedule, and I've talked to a couple of people. Melissa does this too. I look at my future week, and I try to optimize it." And I'm like, "Really? I've never done that. I just assume it gets done, and then I just complain when it doesn't get done right." So what they said is always setting up the next week in advance and filling in those slots and telling staff to hustle and fill those and things like that. I think taking more of an active role versus a passive role. I just tend to be a little bit more passive, but I did check my schedule that day and I just kind of set things up for the future. Okay, so I think that's something good to do. Don't do what I say, and don't do what I do. So I'm learning about that. Okay. Next, another bad thing. There was a patient that had some equinus, and they came in and they stopped doing Shockwave. So they canceled the Shockwave. This happens very rarely, but they canceled the Shockwave treatments, and that made me a little bit sad. It doesn't happen all that much, but I'm just kind of letting you know, good, bad, and ugly. They just wanted to go to physical therapy, so I like to share that. Some of the MVP patients, there was a patient that had nail fungus. They got the nail fungus kit. They did laser. They got Cara 42. And they did the laser. So I'm getting a little bit better at offering, hey, this is the best option for you if you want it, and then we'll do a step down to the oral if this doesn't work. And so this patient did do the laser. So I'm doing a little bit more laser. We're going to see how the results are. Next was a bilateral ultrasound with bilateral Shockwave for the Achilles. So this is number 1 out of 6. So this is a good MVP patient, bilateral Achilles. Everyone asked me, do I discount on this second foot? I tend not to unless they ask. I tend not to discount at all. Sometimes I'll add it on as a courtesy if I'm seeing something, but I tend not to do as many shocks. Okay. A couple of least valuable patients this day. One was a fracture follow-up. Once again, I only got the X-ray, and another was a 5th Met wart or porokeratoma, and this patient was curious of coming in and wanted to come in a week, and they made the appointment. I didn't schedule even an appointment, but he made it too soon. And so once again, warts have a 10-day global, and he came in 7. So really, I didn't even treat the wart. I didn't really do anything. And this was kind of a least valuable patient for me. I guess I could have done an office visit. As I'm looking back, I probably could have treated it just in case, prophylactically with lesion destruction, but it wouldn't have been covered, right? Because it was less than the global. So I would have to just do another diagnosis for another condition, say it was macerated or something like that. This was the other patient that I was talking about. This was an arthroplasty. This was an MVP patient, so it was in the office. And then there's a patient that had a left third neuroma, did an ultrasound, and we decided on doing six Shockwaves. So these were all MVP. So there's a lot of MVPs this Wednesday, and these will be kind of providing fruit throughout. Besides that, there was some other Shockwaves that I did. One for plantar fasciitis, number 3 out of 6. So this was the Wednesday. Okay, now we're working back. This was a Tuesday. I'm going to go over the MVP. One was MVP that had midfoot arthritis, 65-year-old. Midfoot arthritis. We're doing Shockwave number 1 out of 6. Once again, when I talk about midfoot arthritis, we did an orthotic to stabilize things. We did the Shockwave to reduce bone marrow edema. I want to be clear about that. So it's mostly the non-radial Shockwave works better for this, and they were well aware that what we're doing this for. Other MVP patient was a right Achilles that we did get an MRI on, and then they opted for Shockwave based on the MRI. So I was reaching out to another doctor. I was wondering, okay, usually an ultrasound is sufficient, but I'm wondering if ordering more MRIs would help to do more Shockwave, meaning patients, there's more proof in what we're doing. So I think a lot of times it's based on, so if I see a patient and I do ultrasound on the heel and I compare one side to the other, that's what makes the decision. But there are certain things that I can't show on the on an ultrasound. So like midfoot arthritis, other types of arthritis, other types of conditions that aren't really visible on ultrasound. By doing an MRI, I think it might help them to understand the value of the Shockwave. So those were my MVP patients for the day. A couple of others that were good. There was a metatarsalgia patient, number 1 out of 6, once again for bone marrow edema. A left Achilles tendonitis, number 6 out of 6. So that was an office visit, and then we dispensed their orthotics. A peroneal tendon, number 5 out of 6. Second med head, number 3 out of 6. There was one wound patient, and another 3 out of 6 for a left Achilles. So those are the patients for this Wednesday. And now we're getting, or that was a Tuesday. Now we're getting back to a Monday. Okay, let's talk about this Monday. I put on just a couple of the most important patients here. One was a right posterior tibial tendon. This patient, they scheduled 3 out of 6 Shockwaves. Now, why would they do 3? And they got a cam boot as well, and an X-ray and an ultrasound. This was an MVP, but not as MVP as I would like it, most valuable patient, only because they had Shockwave in the past. And it's interesting, what patients get in the past is what they expect in the future. So this patient had 3 sessions, or they heard me talking about 3 sessions in the past. So I say, now I tend to do 6. So the ones that have heard me talk in the past, they tend to want that. So it's just interesting. So however you treat, or however you treat in your practice, how one person treats, it kind of sets the stage for how everyone kind of practices. Okay. Another MVP, there's a 72-year-old female with right heel pain. We set up 4 Shockwaves. Once again, she had 4 a few years ago, and that's why she wanted 4 again. It's interesting about that. Next was a 31-year-old female with a left matrixectomy, and she had left plantar fasciitis. So we did the matrix, and we set up the 6 Shockwaves. Now she is a radiology tech, rad tech, at one of the urgent cares that I see. Okay. And then some of the other Shockwaves, there's a bilateral Sievers, number 6 out of 6. This is a really good athlete. He's a gymnastics kid, and he had the Sievers, 11-year-old. Next was a number 2 out of 6 for a fibroma. And I did a Qutenza, number 6. I probably stopped counting after 6. And then a second status post. This is a patient I did 6 out of 6 for Achilles, and he's status post second digit amp. I'd amped one, and I'm going to amp the other one in the office, and he is doing well. So that was my Monday. Okay, a couple of takeaways. I had a doctor visit recently. I think I talked about this. Was doing office visits for ulcers once a month. I tend not to do that. Getting a different type of an ABI that's quicker, because I'm concerned with this new EMR kind of recall program. My current one is biomedics, and it just takes too long. I think there's a quicker one that takes a lot less time, and we can do it the same day. I think that would help me to do a lot more ABIs for patients. So someone told me about a company called Huntley, or probably there are some other ones, but this is the one. So he does it. This doctor that visited me, he said he does it on every ABI for like older people that have ingrown toenails. And another thing that was kind of interesting, which I don't do, but I thought was an interesting idea, is he has his staff numb up the toes. I don't know if anyone else does that, but I was thinking that's kind of cool how he has his staff kind of numb up the toes. Okay, now we are getting to... We finished, that was that week. Let's see if I have any others. Oh my goodness. So I think I'm going to stop now because I have a couple more days to do because I didn't do these for a while. Hope you guys find these beneficial. I'm just kind of going through kind of what's working, what's not working in my practice. Once again, if you look on Podiatry Practice Mastery, I'm going to be changing. I'm going to be doing like a beta offer. Okay. So one of the offers is going to be to do a kind of in-depth audit of your practice. I kind of got this idea from my friend Jim McDonald. He's doing that. It'll be like an audit where you'll fill out, it's kind of an asynchronistic audit because you don't have time and I don't have time. And so you fill in your information, and I'm going to give you kind of a video breakdown of kind of ways that I think could help you. You know, you can get these same things just by listening to this, but some people want it to be made specifically for them. So I'm going to ask you certain questions, what you're doing, what you're not doing. And I'm going to, give you some results. If you implement it. And then I'm going to have a new implementation group that I'm working on. If anyone is interested in that, basically it's like a kind of like a mastermind or implementation group of like putting actually the pedal to the metal, like doing the work. And so some people just want more help with doing that. They have a hard time doing it on their own. They're too busy. They're confused a little bit. And so I know how that is. I think sometimes it's more beneficial to pay for speed. This is where I'm at in my life right now, where I would prefer to just pay someone. For example, I have Sean that I pay that helps me with the marketing. And so he can kind of like clear out all the noise and help me to focus on what's the most important thing. I have different friends and different things I pay for to kind of clear out the noise, because sometimes we get overwhelmed in what to work on, or we like lose our focus. So if you feel like, hey, that's me, I want to, I don't know, get better at Shockwave, or I want to get better at sales or explaining things to patients, or using the treatment sheets or things like that, you're just too busy to start implementing these things, reach out to me, because it's kind of a select group. I'm going to limit it to 20 people in this group, and we're going to have kind of a schedule of meetings. So if this would be beneficial, reach out to me. Okay, Don at podiatrypracticemastery.com. Okay, talk to you next time.